Hello there. In today's video, we will be exploring hypertension, how it is related to dementia, and the ways hypertension can be prevented. This video is part of a series on how to identify and reduce risk factors for dementia. Dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease and vascular dementia are two of the most common types of dementia. What is hypertension? Hypertension is commonly referred to as high blood pressure. When your heart beats and the blood circulates around your body, pressure is created in your veins and arteries. Too much or too little blood pressure is bad, but for most people, high blood pressure is more likely to be a problem. High blood pressure can lead to an increased risk of stroke, heart attack, and kidney damage. But did you know that high blood pressure can also harm your brain? Middle-aged people with high blood pressure have a much greater risk of getting dementia. When taking your blood pressure, there will be two different readings. The first or top number on the blood pressure reading is your systolic blood pressure. The second number is your diastolic blood pressure, which is the bottom number on the blood pressure reading. A blood pressure reading is considered within the normal range if it has a reading below 120/80. A blood pressure reading that is considered high will be anything above 130/80. It is normal for blood pressure readings to vary from time to time. Sometimes you might have a higher or lower blood pressure than what is considered normal. Therefore, it is good to measure your blood pressure regularly so you can observe patterns in your blood pressure readings. If your blood pressure reading is consistently high or low, you should consult with a doctor to make sure everything is okay. It is important to test your blood pressure because there are often no signs or symptoms of high blood pressure. This means that you can have high blood pressure without knowing it. If you have never tested your blood pressure before, or want to start doing it more regularly, here are some ways you can start. The next time you visit your doctor, you can ask to have your blood pressure taken. You can also buy a doctor-recommended blood pressure cuff machine, so you can take your blood pressure in the convenience of your own home. Blood pressure monitors can also be used for free in many pharmacies. When you are taking your blood pressure, make sure that your feet are placed flat on the floor. It is also a good idea to measure your blood pressure at the same time every day to get consistent and reliable results. To keep track of your blood pressure, write your results with the date and time it was taken. Having a blood pressure log can be a great source of information to share at your next doctor's visit. Now, you might be wondering, how common is high blood pressure? Blood pressure rates among those between the ages of 50 and 64, 21% of women and 27% of men have high blood pressure. As people get older, high blood pressure also becomes more common. By age 70, 69% of women and 71% of men have high blood pressure. So, how can high blood pressure increase your risk of dementia? A good rule of thumb is what's good for your heart is good for your head. High blood pressure can contribute to stroke and heart disease, which are diseases that can lead to vascular dementia. Vascular dementia occurs when blood vessels are damaged and the blood circulation is reduced, leading to an impaired supply of oxygen to the brain. Having high blood pressure during middle age puts people at a 60% greater risk of developing dementia, compared to those in middle age without high blood pressure. It is also important to measure the blood pressure of people living with dementia, because high blood pressure will be harmful for them too. There are strategies that people can use to help them lower their high blood pressure. For example, it is important to maintain a healthy weight. Being obese or overweight is a large risk factor for having high blood pressure. Please see our video on obesity for strategies to address weight loss. In addition, eat a healthy diet. Those who eat less than 5 servings of fruits and vegetables per day are more likely to have high blood pressure. Eating a healthy diet rich in whole grains and lean fish and meat is also helpful. Foods that have a lot of nutrients such as fiber, calcium, potassium, and magnesium have many health benefits, including helping you maintain a healthy blood pressure. There are also a few things you should avoid eating. This includes saturated and trans fat. Cut down on salt. Excess salt raises blood pressure. The recommended daily intake for those aged 70 or older is less than 1,200 milligrams of salt per day, but most older adults exceed these limits. Avoid processed foods as they tend to be very high in added salt. Exercise regularly. At least 30 minutes of exercise per day is recommended for lowering your blood pressure as well as helping prevent dementia. Manage your diabetes. Diabetes can harm your blood vessels and increase your risk of developing high blood pressure. If you smoke, quitting can greatly reduce the risk of developing high blood pressure. Also, if you drink alcohol, try limiting your consumption as it can be beneficial to your health. Stress is also linked to high blood pressure. Learning how to manage stress through meditation and yoga can be helpful. You can also watch our videos on nutrition, active living, managing diabetes, quitting smoking, managing alcohol consumption, and stress to learn more about strategies to reduce your stress. Medications are also available to treat high blood pressure that cannot be reduced through lifestyle changes alone. In cases where blood pressure remains high, despite adopting a healthier lifestyle, these medications can help to lower your blood pressure and reduce your risk of developing dementia and Alzheimer's disease, as well as many other health problems. Consult your doctor, who will recommend a blood pressure medication if needed. It's never too late to start treating high blood pressure, as managing blood pressure is one of the best ways to improve the health of your body and brain.